there is a real difference of opinion, a difference of understanding of what accountability means. Local government understands short chain accountability. Someone within a town makes a decision that's immediately visible and people know who to talk to. In the health service, traditionally, or for the last 60 years, accountability is long chain. It goes right from the point of service back up to the Secretary of State. That's where public scrutiny actually comes in formally. Don't work like that in local government, and local government officers understand that you do something, you hear about it from people very, very quickly. And that was very apparent in our roundtables as part of the research, where we had local authority officers and members railing against the lack of political savvy amongst their health service colleagues. And at the same time, health service colleagues railing about the politicisation of the service and about the governance of the service, or potential governance of the service, by people who didn't have professional or clinical expertise, i.e. counsellors. They don't have expertise in this sector, so why are they making decisions? Which is to fundamentally misunderstand the point of counsellors. But what we've got is a situation where both sides think that each other's understanding of accountability is a problem, rather than a potential strength. What we've seen from health sector colleagues around in these roundtables is this desire to see the politics done and dusted, to get it out of the way. We do the politics and then we get on with the real work, which is fundamentally misunderstand what local government is. It's a political game. That's exactly it. The reason there are councillors on the Health and Wellbeing Board is because they're elected. And to understand that role and that important role and what that brings is vitally important if this new settlement is going to work. So you can either see the politics, local democratic accountability, whatever, as a necessary evil which you need to get around, or you can see it as a tremendous opportunity. For a start, it makes this point about involving the public in decisions and taking people with you far easier to do, because you have to do it, because it's going to come and bite you if you don't do it. So there's that. But there's also an advantage to the organisations, to the agencies involved in a professional way, because, and I recognise that almost all of you are health service, there are local government people in the room. Have I any friends? One, okay. Good, I'll look at you. Yeah, so I noticed that. Councillors, and therefore councils, see people first and foremost as citizens. Health service sees them first and foremost as patients. That means that councils, local government, is pretty good at recognising the rounded, full approach to both preventing ill health, dealing with ill health, and promoting health. Sorry. Preventing ill health, dealing with ill health, and promoting health. And seeing the health of a community rather than a series of individual patients, rather than a series of episodes. Now that helps bring together the different players in a way that's been quite difficult to do in a purely clinical health sector. I'm going to get shot down for this, I know I am. But I think that the bringing the two sides together, because they're both important, they're both valid, they're both right, is going to make this work. Now, of course, it isn't all necessarily going to work out. The politics and professionals may never see eye to eye. Organisational cultural differences, the mistrust between the sectors might yet scupper meaningful collaboration. We may get bogged down in process, in institutions, in structures. It's happened before. We may miss the point, the outcomes that we're all intent on achieving. We may find that thinking bigger and thinking wider is just too difficult. It's easier to stick to the knitting, the things that we know how to do. And of course, the system might just become yet another forum in which to argue about too scarce resources. But I think, and I'm confident of this, and this is why we continue to work in it from the local government side, that the new settlement offers an opportunity to develop a whole place approach to promoting healthy communities. If we're going to do that, then councils have got to get better at talking to other players. Other players have got to recognise the strengths of councils too. And I think if I've got a sort of final triptych of things to leave you with, if this is going to work, both sides have got to recognise each other's strengths. Both sides have got to be honest about their own weaknesses. And both sides have got to commit to working together to promote good health in local places.